Surveillance, response and containment are foremost strategy to contain spread of COVID-19 outbreak. This video is part of interaction review of COVID-19 response in the state of Gujarat based on WHO's 10 strategic pillars of COVID-19 joint response plan. Present video highlights strategies employed under pillar 3, surveillance, response and containment.
We'd like to share that Gujarat was one of the first states which did a complete house-to-house surveillance way back in March. We started it. Similarly, we included during the surveillance campaigns the identification of influenza-like illnesses, ILIs, and severe acute respiratory illnesses, SARI cases also along with the surveillance drive. Arogya Setu, which was implemented across the country, was picked up very seriously by Gujarat, and particularly the implementation of an initiative called Itihas, where we were looking at the consolidated COVID hours and plotting it spatially for the 15 days preceding somebody being tested positive as COVID. And we were actually going to those areas which were identified as hotspots and actually do a very detailed surveillance testing in those areas. Additionally, the COVID tracker in our treatment, case management facilities, hospitals, was of great value. We have, in fact, a full-fledged consolidated command and control room at the central level, which looks at these COVID trackers, each and every patient, how they're doing and so on. Community pulse oximeters were also very widely used. So we had health workers, including ASHAs in many places, who would carry these pulse oximeters. And many of our team members from the corporations feel that several hundreds and perhaps even thousands of lives could be immediately saved because they were identified and brought to the health facilities immediately. We also engaged the preventive social medicine departments of various medical colleges and converted these into RRTs, rapid response teams. And we also set up these epidemic intelligence units, which were in constant touch with the collectors and the officers there. They would go to the field.
Wherever initial 7-8 cases of positive COVID positive cases came to our notice, we did intensive contact tracing of their family members, people with whom they came in contact. We did home isolation, preventive quarantine of this facility-based quarantine of these contacts, and did their testing wherever we found symptoms. Now, intelligent referral system helped in minimizing the time between one arrival of ambulance and availing of treatment.
Another innovation I would like to share is that right in the beginning, our first case came from a particular area called Jangleshwar in Rajkot city. For the first month or so, there was a huge focus on that area. There was a population of around 50,000 persons who were just completely contained. And in order to facilitate all that, we had camps in the UHC itself, and all kinds of issues were taken care of without having the people required to move out.
To roll out the surveillance, contact tracing and containment of areas in Gujarat, the state government adapted following plans and strategies: interdepartmental coordination in development of human resource, expanding the medical services at government public health facilities, outreach of medical services in high-risk areas, promoting community participation for surveillance. This video is prepared by Indian Institute of Public Health Gandhinagar with support from the World Health Organization. We thank the Department of Health and Family Welfare, Government of Gujarat for their support and cooperation.